Hi, I'm Charlie Peterson.
Hi, I'm Alexandra Guevara.
This is Asking for a Friend. You ready?
I'm ready.
What is pelvic floor physical therapy?
In this model, you can see the pelvic floor. We really teach patients that those muscles, they help to support all those internal organs. They span from the front of that pubic bone or that pelvis, and they come all the way to the back towards that tailbone. These muscles are really important for bowel, bladder, and sexual function, as well as, around that time that we're giving birth or delivering. And what pelvic floor physical therapists or pelvic health physical therapists can help to do is to really evaluate what's happening at your pelvic floor so we can really help to manage those symptoms. Can pelvic floor exercise help prevent bladder prolapse?
So bladder prolapse is when the bladder shifts down into a lower position and it leans back against the front wall of the vagina. This can be really mild or more severe. Some people have no symptoms, and other people might have symptoms like a heavy pressure feeling, a bulging or falling out feeling, or they might notice more urine leakage or even difficulty urinating. The pelvic floor muscles, they act like a little hammock to help support the organs from below. So we know that pelvic floor training can help reduce the symptoms of pelvic organ prolapse and may help improve the position of the organs. We don't have enough research yet to know for sure if pelvic floor muscle training can prevent prolapse. The risk factors for prolapse include things like parity, which is a pregnancy that reaches at least 20 weeks, vaginal delivery, obesity, connective tissue disorders, menopausal status, and chronic constipation. So while it makes sense that improving your pelvic floor muscle strength and health is helpful for the support of the pelvic organs, we don't really know if it's enough to counteract some of these other risk factors for everybody. Any tips for strengthening your pelvic floor at home?
So the first step is really understanding a little bit more about your pelvic floor. Can you feel yourself contracting that pelvic floor or lifting up and in? Can you feel yourself relaxing that pelvic floor? Because oftentimes we have people that come in and see us and they really think that they're doing something correctly when in fact they're doing something a little bit different than what should be done. So everyone's pelvic floor is a little bit different. So your exercise routine might be a little different than my exercise routine versus yours, Charlie. And I think really understanding some of those motions of the pelvic floor can be really helpful. So if you're really concerned about how to do those pelvic floor exercises at home, we are the ones that you can come and see and really get a specialized and tailored plan. So that way you know that you are performing those exercises correctly at home. How does pelvic floor physical therapy help with sexual dysfunction? Can pelvic floor physical therapy help with painful sex?
Absolutely. That's actually a pretty common reason that we see patients. The pelvic floor muscles are an often overlooked cause of issues with sex and especially pain with sex. And pelvic floor or pelvic health physical therapy can be really effective at helping with pain with sex. It's also important to talk to your medical doctor too, just because there's other things that can cause pain with sex. You want to make sure you're ruling out. And I also think it's really important to recognize that our emotions, our beliefs, our identities, and our relationships play a huge role in our sexuality. And there are amazing people called certified sex counselors and therapists who help people process and talk about these issues. And you can find one on the American Association of Sex Educators, Counselors, and Therapists. Their website is aasect.org. And I definitely see patients where it's a combination of approaches that helps them. So they might be seeing us for pelvic floor physical therapy. They might be talking to their doctor, keeping them updated at the same time, and working with a counselor or therapist.
This is Asking for a Friend. I'm Alexandra Guevara.
I'm Charlie Peterson. It's been awesome to talk through these questions today, but please remember, these are general questions for general answers. They are not a substitute for individualized medical advice from your healthcare provider.